Hello and welcome once again to this channel, Clinic Wahala with Dr. Catch. On this episode of One for the Road, my mothers, my fathers, brothers and sisters, those who are already battling arthritis. I did a video, not one, about 3 videos on arthritis so that you will hear and learn. Please, if you are already battling with arthritis and you have gone to the pharmacy and they've given you medications, open that bag and check those medications. Please, if you see a drug called Prednisolone, you should actually shift it to one side. Yes, shift it to one side. I've warned and told you severally. I know it's a problem with Nigeria because our laws and regulations are not in place. Normally, you're not supposed to access such drugs from a pharmacy. You're supposed to do that with a prescription after seeing a doctor. I've had instances of people, once you complain of pain or fever or joint pains, they will pump you with drugs, including Prednisolone. And these are elderly people who are already battling with hypertension and diabetes. Most cases, you now notice that your BP is soaring high, your sugar becomes a problem to control. Then those that didn't even have BP and sugar suddenly start having BP and sugar because they have been pumping themselves with Prednisolone. I've heard how many patients that have come with these problems, and you are jumping from frying pan into the fire. Please stop the habit of always going to pick drugs from the pharmacy for anything. It's always good you get the counsel of a doctor. It's important. Yes, it may cost a little more, but it's safer because part of the thing about health is that doctors will also not do harm. They will not do harm. It's not just about treating and doing good. Not doing harm is a bigger issue than doing good. Many people can just clone treatment and do good, but the harm is the problem. Many people have come down with bad ulcers and gastrointestinal bleeding because of this Prednisolone. Our bodies produce steroids. Prednisolone is a steroid. Our bodies produce steroid, and most times the steroid produced by our body is good enough. But when we need external steroids like that Prednisolone, your doctor knows the conditions where those drugs, those steroids are needed, and the doctor also knows how to administer them to those particular places, and the doctor also knows precautionary measures to take to make sure that these drugs do not affect their harmful effects on you. So please stop the habit of getting drugs from the pharmacy without a doctor's prescription and guidance. Then if you're already on Prednisolone, you may also need to go and see a doctor so that these things, it may be the problem why your BP is not controlled, or why you are developing hypertension, or why your sugar is still not controlled, or why you are developing diabetes. So please see a doctor for your arthritis and let the doctor go through your medications and give you the best management plan. Thank you very much. Have a great day. Don't forget to like. Don't forget to subscribe. Don't forget to share to people that are involved. Our mothers and our fathers in this country, they need to hear this. So make it a point of duty to share so that they can learn and stop the destruction before it gets too far. Thank you very much.